combine both immunotherapy and target therapy, do you think it'll also be able to help cure other cancers like brain cancer, lung cancer, etc.?
I think it will definitely do that. This is how most science works. So you apply something on one disease and then you learn from it and then you try, of course, to apply it to other diseases. And I can tell you that, for example, the immunotherapy with anti-CTLA-4 has shown very good results on melanoma, and now it's being used for prostate cancer, which is the beginning. And I have another question here, and I'll come back there.
Actually, what age is this melanoma affected?
Can you say
what age does it really affect? What age does melanoma affect?
Oh, what age group? So melanoma will affect any age group, but it's not a pediatric disease. It's mainly aging people which will develop melanoma. Will have a higher incidence in people who get old, but it is because of what you did when you are younger, which is go to the beach without sunscreen. So you need to put sunscreen on.
What was another disadvantage of the targeted therapy?
Another disadvantage of the targeted therapy, I don't remember how many. So one of the disadvantages of the targeted therapy is the fact that you develop resistance. Did I say that? I guess that was not a question, that was just you need a table back. Yeah. There is one disadvantage, which is resistance. I have another question somewhere else there.
What is the cause of melanoma, and does that include skin discoloration or sun damage to melanoma? And are there any methods to prevent melanoma from happening?
So one of the best ways to prevent melanoma from happening is to protect yourself from sun. That's the only thing we need. That's the main cause we know, okay? So one of the major causes of melanoma is exposure to unprotected exposure to UV, and the best way to prevent it is to actually prevent yourself from being exposed to sun too long. And I guess you need to stay away from, but that's valid for any cancer, for all genotoxic agents, which are mutagens, like eating too much canned food and all that stuff. So, and I didn't hear the first part of your question.
Basically, skin discoloration or
Oh, the skin discoloration has nothing to do with melanoma. It's actually, if you have skin discoloration, which is called vitiligo, it's a very good thing, because it means that in terms of melanoma, it means that your immune cells are killing your melanocytes, and it means that if you had melanoma, your immune cells will kill your melanoma as well. So it means that you are doing what we are trying, so that nature has been doing what we were trying to do in the lab and on the patients.
Other than pigment changes on the rats, what are the other side effects of the treatments?
No. Yeah, just the pigmentation. None that we know. Yes.
You said that on one of the slides in 1934 it was 1 hour, 1,500, and now it's a lot less. And
No, not more.
Oh, that's what I mean, a lot more.
Yeah.
So you said the main cause is being in the sun or exposure to the sun. What do you think has changed between that time and now that it's increased the amount of people who are causing as problems?
So there, I can tell you things, but it's all speculative. We don't have any proof, so there is life change. I don't think, for example, people were tanning before. In the 30s, I don't think as many people were vacationing and going to the beach and having and just tanning. And the other difference is maybe people ate or were exposed to less things which would give you cancer. And the example that comes in mind is, people who are eating organic food. They were not eating food from a can which was full of preservatives and stuff like that. One more? I don't see it. Oh, sorry. I don't see it. Sorry for the
Yes, the answer for the question. I started majoring with some environmental science. That over the past years, the sun heat has been rising. Arthritis has been higher. Like back then, like science has to go out of it. For example, let's say if you get someone from back in history, like with that disease, it wouldn't be like the same as now, because the fact that sun radiation wasn't high as much as it is now.
But maybe, yes, maybe the changes in ozone layer makes us exposed to UV. I think is a very good hypothesis. I agree. Thank you. That's very smart.
Another question was like, how do you identify like the different stages of melanoma in patients?
So this is a clinical question, it's not a condition, but the way they do it is they actually measure the thickness of the lesion, they measure the width of the lesion, how, if the lesion is small or large, okay, and then they do biopsy, so which means they take a piece of skin and they do section and look in histology, and depending on many criteria, they will decide whether it's a stage 1, stage 2, stage 3, stage 4. There are many criteria, and basically the worse you get, the more advanced stage you have. Sure. That's all? Yeah.
When we go to the beach, we actually most of us use cream and protect our skin not to get burned by the sun. But does it really prevent the cancer or inflammation?
I think the best way is to, and I don't, no one will like it, but the best way is to wear those shirts which you can swim with. Sorry. That's boring, right? It could save your life. I think I'll finish here because I need to go.